Did you know there was something called the halo effect, which can influence the first impression? Well, when we perceive someone as having one positive trait, such as being really attractive, looking good, we often assume they possess other positive traits as well, like intelligence or kindness, even without having any evidence. This is On the Couch with Dr. Ty. Welcome back to On the Couch with Dr. Ty. I hope everybody has been feeling good over the last few days. We've got all kind of things going on in the news, in the world. And sometimes those things have the tendency to just kind of take over a lot of our thought processes, make us feel a little anxious, make us feel a little bit um, overworked. Today, I'm hoping that we'll be able to talk about a condition that is one of the most common mental health conditions in the world. And that condition is generalized anxiety disorder. It's often referred to as GAD. Now, before we begin, I want to point out something very important. Anxiety is not a disease. In fact, anxiety is a normal and healthy human emotion. Every one of us experiences anxiety before a job interview, maybe an important exam, sometimes a first date, or even when we're facing uncertainty. Anxiety is part of our survival system. It helps us recognize threats and prepares us to respond to these threats. The problem generally occurs when anxiety becomes so excessive and persistent and oftentimes difficult for us to control. When worry starts driving the bus instead of simply just taking a ride as a passenger, it can significantly interfere with our daily lives and those activities that encompass our lives. That is where generalized anxiety disorder enters our conversation. So, what is generalized anxiety disorder? Well, generalized anxiety disorder is characterized by excessive worry about numerous aspects of life. And individuals who experiences GAD often worry about work, health, finances, relationships, sometimes even school and family members, and even events that sometimes haven't even started yet. What separates normal worry from GAD is its intensity, its frequency. Sometimes its duration of the worry is what's most important. People with GAD frequently describe their minds as kind of not having the ability to turn off. They may wake up worrying or spend most of the day worrying. And oftentimes, some of my clients have even reported they go to bed worrying. The Diagnostic and Statistical Manual of Mental Disorders, fifth edition, text revision, or what we call the DSM-5-TR, it states that excessive anxiety and worry must occur more than not for at least 6 months and be extremely difficult to control. Imagine carrying an invisible backpack filled with concerns, fears, and often worst case scenarios every day of your life. That is often what some folks have described as struggling with generalized anxiety disorder. So you might ask, how common is GAD? Well, here's a fact that might surprise some of you. Anxiety disorders are most common category of mental health disorders worldwide. In the United States alone, millions of adults experience anxiety disorders each and every year. Some of our research suggests that women are diagnosed with GAD approximately twice as often as men. However, many experts believe men may be undiagnosed because they often express anxiety differently, or we're less likely to seek treatments when we do have it. Another interesting fact I'd like to share is that anxiety doesn't discriminate. Absolutely not. It affects people regardless of their age, their education, their income level, their profession, their religion, or even their cultural background. Teachers experience it, doctors might experience it, college students experience it all the time. Even psychologists like myself experience it. No one is immune from anxiety. When you ask individuals, what does anxiety feel like? One of the biggest misconceptions about anxiety is that it only exists inside the mind. Actually, research suggests that anxiety is both not only psychological, but also physical. Individuals with GAD often report symptoms such as constant worry, restlessness, irritability, muscle tension, difficulty concentrating, fatigue, sleep problems, feeling keyed up or on the edge. A term that we like to use is feeling hypervigilant. Many people are shocked to learn that anxiety can mimic serious medical conditions. Some of these symptoms are like rapid heartbeat, chest discomfort, dizziness, SOB or shortness of breath, nausea. Sometimes there's reports of trembling and having the shakes, diaphoresis, things of that nature. And as a former nurse, I can tell you that countless individuals has visited emergency rooms and a lot of the hospital wards believing that they were having like heart attacks or mild strokes, TIAs, only discover that they were experiencing severe anxiety and or symptoms that mimic panic disorder. That doesn't mean that the symptoms are all in their head. The symptoms are real. The body is genuinely responding as though danger is getting ready to rear its face or be present. So you might ask, why am I anxious? Why does anxiety happen? Well, there isn't one single cause of generalized anxiety disorder. Instead, the most recent research believes anxiety develops through a combination of not only biological factors, but psychological and environmental factors as well. So let's start just for a second about the biological factors. There are certain brain regions that play significant roles in anxiety, particularly that brain region that we call the amygdala. And the amygdala acts like the brain's alarm system. When danger is detected, the amygdala sends signals that activate the body's fight or flight response. You guys remember that, right? The challenge is that the individual with anxiety disorders, this alarm system can become oversensitive, overwork, working overtime. I like to characterize it as being somewhat like a smoke detector that continues to go off in grandma's house or maybe even your own home. Every time you burn something, popcorn, toast, whatever that might be, bam, the alarm goes off. It's just reacting a little bit too often, right? Anxiety can function the same way. Genetics also play a role. Individuals with family histories of anxiety disorders may have an increased risk of developing anxiety themselves. Thanks, Mom. Thanks, Dad. And our environmental factors also play a role. Trauma, experiences, or being progressed to chronic stress issues. We can have financial struggles. We can have relationship difficulties, military combat, even medical illnesses and major life changes. All of these experiences can contribute to anxiety symptoms. Here's an interesting fact about the brain and anxiety. Your brain cannot always distinguish between a real threat and an imagined threat. If I were to place a tiger in a room wherever you are right now, your body would immediately react. Your heart should start to increase, your muscles would tense, adrenaline would surge. You might even get a little sweaty in areas you didn't even know you had sweat glands. Now imagine that the same response is occurring because you worried about the next month's bills or a difficult conversation that you're going to have with a family member or a friend or your instructor, or even a future event that may never even happen. The body reacts similarly. The brain essentially says, danger, danger, danger detected. The body says, roger that. and then off we go. This is the reason chronic anxiety can be exhausting. Your body is burning energy preparing for threats that may not even come to fruition. So, common thinking patterns related to individuals with GAD often engage in what we call cognitive distortions. And cognitive distortions are these patterns of thinkings that often increase our anxiety. I'm going to give you a few examples of some of these cognitive distortions. One of them might be something that we call catastrophizing. And when you catastrophize, you assume the worst possible outcome is going to occur. Here's a good example. I didn't do as good as I should have at work, so they're probably going to let me go tomorrow. That's why they're calling me in early. Sometimes we have fortune telling, and fortune telling is also a pattern of thinking that also can increase anxiety. And it kind of looks like this: predicting negative events without any evidence. I don't think I'm going to do good when I speak in front of the class tomorrow. I know for a fact it's going to be disastrous. Overgeneralization also is another form of a cognitive distortion that will also increase people's anxiety. In overgeneralization, usually when taking one negative experience and applying it in a broad sense, if you will. I failed the test. I will never be anything, and I'll be exactly what my mommy or my daddy said, unsuccessful. Lastly, we might even have mind reading. We've all known people, or at least have experienced this type of cognitive distortion, if you will. This is when you're assuming you know what others are thinking. You have a crystal ball, if you will. Oh my gosh, I posted a picture of my sandwich and nobody told me how wonderful it looked. People must not be my friends anymore. Or I text 3 minutes ago and they didn't text back. I must have said something that I shouldn't have said. They're probably mad at me. Most of us engage in these thought patterns occasionally, but individuals with GAD often experience them repeatedly throughout the day as they wake and as they go through the day and as they settle down at the end of the day. Some little historical facts about GAD. Here's an interesting one I like to share. Anxiety is not a modern invention. Absolutely not. If you look at some of our old books, the ancient Greek physicians described symptoms resembling anxiety disorders easily 1,500 to 2,000 years ago. Philosophers such as Seneca wrote extensively about excessive worry and fear of future events. Nostradamus predicted some things that had us thinking and had individuals predicting future events. Even throughout history, humans have struggled with all types of uncertainties. The difference today is that we have a better understanding what anxiety is and how to manage it. So, can anxiety be helpful? Absolutely. A small amount of anxiety can improve your performance. This concept of improved performance by having little squirts of anxiety is known to us as the Yerkes-Dodson law. Moderately anxiety helps us to stay alert, motivated, as well as focused. Not enough anxiety can result in complacency. Too much anxiety can impair performance. Think of anxiety kind of like a shot of 5-hour energy drink. A little may help, but too much of it makes you jittery and ineffective, shaky, sweaty, so on and so forth. So the goal is not to eliminate anxiety entirely. The goal is to manage it as effective as we possibly can. The good news about GAD, it's highly treatable. One of the most effective treatments is CBT. That's where I got that cognitive distortion that I was speaking about earlier. CBT helps individuals identify unhelpful thinking patterns, distortions, and replace them with healthier perspectives. I'm not all bad. There's some good in me. I'm not a failure. I just didn't do so good on that. I can't predict what they're thinking. I'm just going to do the best I can and keep it moving. Research consistently demonstrates that CBT, cognitive behavioral therapy, can significantly reduce anxiety symptoms. And that's the whole goal, right? Right. Other treatment approaches include acceptance and commitment therapy. We've got mindfulness based interventions, sometimes medications when they're appropriate, lifestyle changes or modifications, and oftentimes just managing stress or stress management training can also help. Exercise deserves some special attention. Believe it or not, some research suggests that daily amounts of exercise not only help you physiologically and psychologically, but can also just give you a little bit more well-rounded life. Regular physical activity has repeatedly been shown to reduce anxiety symptoms as well. Some researchers even describe exercise as one of the most underutilized mental health interventions available. Yeah. Sleep is really good. Excellent sleep hygiene will have you plugged in and decrease anxiety if you're experiencing it on a daily basis. Poor sleep, we already know, increases anxiety. Increased anxiety worsens sleep. This creates the what I call the vicious sleep cycle. And breaking that cycle often becomes a major focus when we're trying to help people manage anxiety. How about some interesting facts about anxiety? Well, people with anxiety often have highly active imaginations. Can you believe that? The same ability allows them to anticipate danger can also contribute to creativity and problem solving better than other folks. Public speaking consistently ranks among some of the most common fears reported by adults, often exceeding fears related to illness, injury, and even death. Your brain uses approximately 20% of your body's energy despite representing only a small percentage of your body weight. Chronic worry can literally be mentally tiresome, wear you out, be exhausting. Deep breathing works because it's directly influenced the autonomic nervous system. This is not merely for psychological purposes, but also for physiological purposes. Many highly successful individuals have openly discussed their experiences with anxiety. Athletes, actors, business leaders, military personnel, mental health professionals like myself. Anxiety is real, and anxiety can cause you to sometimes just stay in a constant state of panic. And when you're in that constant state of panic, it's very difficult to follow through with activities of your daily living. If there's one thing that I'd like you guys to remember today, I'm hoping you'll understand that anxiety is not a weakness. Mental health is not a weakness. Anxiety is not a character flaw. All anxiety is not bad anxiety. Anxiety is not a lack of faith, intelligence, and/or resilience. Anxiety is a human experience that can sometimes become problematic when it grows beyond our ability to manage it or to seek help or treatment in trying to manage it. The encouraging news that I'm trying to share with you today is that it helps to exist. It helps to encourage all the information. It helps for treatment. It helps for recovery, and know that recovery is possible. Whether you're someone who struggles with anxiety personally, or you know someone who has anxiety, understanding the conditions is the first step toward reducing the stigma and promoting healing. I really appreciate you guys hanging out with me today. And again, if you enjoyed this, I'd like you to share it, subscribe to it. Just let a friend know that we meet every Monday where we have interesting topics, things of discussion, most things mental health. And like always, I want you to stay safe and stay smart. This was On the Couch with Dr. Ty.